Today is the 72nd anniversary of the founding of the NHS in Scotland and of our social care services. As with any birthday, this is a chance to both acknowledge the impact of these services on all of our lives, but also to reflect and say thank you. This year, coronavirus has given us the biggest challenge we've ever faced, so there has never been a more important time to recognise the contribution of everyone working in our health and care services. So to all of you, thank you. I'd also like to acknowledge the impact of and contribution of all the partners that we work with on a daily basis, whether that's the council, other emergency and public services, and also the voluntary sector who we work with all the time to make an impact on the care we provide to our local community. During the coronavirus pandemic, we've had to radically change the way we provide our services, and our staff have responded with flexibility and innovation to make sure that we can continue to provide services to our local community. As members of staff, many of you will have been working in unfamiliar circumstances and had to learn new skills, and many of you will have been personally affected by COVID. However, every single one of you has worked so hard to ensure that we support our local community and meet the pressures we've faced, and I could not have been prouder of your response. I would also like to say a big thank you to the whole community of the Borders for the incredible encouragement and support that you have given our staff, but also the way in which you have contributed to us addressing the coronavirus pandemic and complying with lockdown. You have really made a difference, so thank you.
I want to thank the amazing public in NHS in the Borders. We are so grateful for everything that you do for us. You've supported us all these years and you have supported us through COVID-19. Every sacrifice that you've made, the small sacrifices and the large sacrifices, have allowed us to deliver the services like we've never delivered them before. The clapping every Thursday night, the rainbows, the gifts, that's brought a smile to many faces in the dark days, and that's actually enabled us to do the job we do. I think this is actually our time to thank you, so from every member of staff in NHS Borders, thank you for all that you do.
Hello, I'm Karen Hamilton. I am proud to be Chair of NHS Borders, and I'm also a trustee of The Difference, which is NHS Borders' official charity. We have had so many well wishes and expressions of support from the local community, but we also want to thank you for the practical support that has been overwhelming. We've been blown away by the generosity that has seen our staff and our patients receive countless donations of food, toiletries, care packs, and even shoes for work. You've been incredibly innovative and imaginative with your local fundraising efforts during lockdown. And as a member of the NHS Charities Together, we were grateful beneficiaries of some of the national fundraising too. Not least that from the amazing captain, now Sir Tom Moore. I know, locally too, many have replicated his achievements, walking up and down stairs, around gardens, and even a virtual ascent of Everest. We are so grateful for what all these donations have allowed us to do. Just a few examples. We've been able to pass on the donated toiletries and essentials direct to our patients. Donations have enabled us to provide electronic tablets for inpatients' virtual visiting, which has helped people keep in touch with their families. Tablets have also helped people access their virtual appointments. We've been given benches. We are able now to create outdoor spaces that help staff take a break while still maintaining social distancing. So, rest assured, we will continue to use your donations to help our staff and patients respond to the challenges posed by this virus.
As things change and as we develop and evolve, I want to thank everyone for their patience and forbearance as we set services back up again. It was quite easy to stop services, but actually restarting them in a safe and orderly way is the challenge that now faces us. It will all look a bit different in the future. You may come to the hospital or to the health centre and people will be wearing masks. You may be asked to come alone to minimise the risk of infection, or even do things by telephone or the video conferencing setup that we now have. So bear with us, and I want want to thank you for doing that as we get all our services as near normal as we possibly can. As we look to the future, it's pretty clear that the last few months, challenging though they've been and tragedies though they have happened, there have been so many good things that have come along with that. The willingness of staff to work together, the collaboration that we've done between health and social care across SPC, everyone has put their shoulders to the wheel, not least the public and the staff in particular. Health and social care have evolved hugely over the last 70 odd years. It's pretty much unrecognisable now to what Beveridge originally envisaged after the war. But the service has become so loved, so respected around the nation that if we can continue to work together, it will have another 72 years and be even better at the end of that time.
I'm thankful for the huge support we've had from the local community.
And I'm thankful for all the teams that I've joined over the past few months and how they've made me feel welcome and wanted.
I'm thankful every day for working with such an amazing and resilient workforce.
I'm thankful to the NHS for giving me the opportunity to help so many people over so many years. It's been a great career and a great life.
I'm thankful for the commitment and flexibility that's been shown by our staff and also the support that we've received from the wider community.
I'm thankful for such dedicated, hard-working and compassionate teams in my own local hospital.
I am thankful for supportive colleagues and that my friends and family are safe and well.
I am thankful for the positive thoughts, time and support of patients, our staff and the public at large.